This is Pod Populi, podcast for the people.
Welcome everyone to the Fusionary Health Podcast. I have a special guest in store for you today, Dr. Sabrina Falquier. Welcome, Dr. Sabrina.
Thank you so much, Dr. Gupta. I so appreciate the invitation to be on your show.
Well, I'm so excited to have you today. I know that you are a culinary medicine specialist. And what's interesting about Dr. Sabrina is she's a triple board certified physician who specializes in culinary medicine. She's an award-winning international educator, professor, culinary instructor, speaker, doctor, and podcast host. And she's the founder of Sensations Salud, which focuses on empowering through nutritional knowledge and culinary literacy by way of culinary medicine education and consulting. So I'm so excited to have you on the podcast today because culinary medicine to me embodies so much of what I teach and so much of what I focus on with people. I'm like, food and spices can do the majority of the job here when it comes to our health. And then everything else is lifestyle. And it just sounds like you're doing so much of what I feel like is needed in the world. So thank you for joining me today.
Yes, thank you. It's always funny to hear your bio read out loud. It's like, oh yes, I do all those things.
It's true. It's so true. So will you share with us what led you to going to med school, becoming an MD, and then what led you to leaving private practice and primary care medicine and moving into the career you're in now?
All right, we're going to go back a few decades. So I grew up in Mexico City. I was born and raised in Mexico City, and my parents are of Swiss and American origin. And the reason I bring that up is because that affected my upbringing, meaning the foods I was having when I lived in Mexico were kind of the spices and all the complexity of flavors and the sitting around the table and really enjoying meals. Meals were really a part of the culture and a part of our family values. And then in summers, some of the summers, I would actually go to Switzerland and spend time with my grandparents there. And there, the meals were much more simple, but it was truly going every day with the little rolly cart to get the foods and the ingredients that we're going to eat that very day. Peak season, really simply prepared. I specifically remember an apricot tart that my grandmother used to make that I started making. It literally is the dough, the pastry, and the apricots, and that's it. Peak season, you didn't even have to add any other sweetener.
Wow.
So between those two, this was already a big part of me. I moved to the US when I was 11, went down the road of becoming a physician. And part of that was from a personal experience I had of having surgery when I was pretty young, having a grandfather that was very much a father figure to me who was a radiation therapist. And so seeing kind of what a doctor looked like. And I was so curious about how the body functioned. So I majored in anthropology, and that sounds like a total outlier for some, but that study of culture and people, and this kind of winds around to the present time. Yeah. So went to medical school, finished residency, and practiced for 15 years. And I enjoyed food during this time, but it really was a side dish, pun intended. And I went to a conference, and the conference is up in Napa. It's called Healthy Kitchens, Healthy Lives. And it's a collaborative effort between the Culinary Institute of America and the Harvard School of Public Health. And when the keynote speaker started talking, I actually started crying to realize that my career in medicine and my passion of food actually had a joining point, that they weren't something that had to be separate.
Wow, that's amazing. What a cool pivotal moment. I can just imagine what it was like to sit there and realize I had a moment like that too. I was in business school and I was studying social entrepreneurship. And a professor had said, you know what, I know you feel like you don't belong here, but why don't I put you in this class? I think you'll find where you belong. And all of a sudden, it's like all the air leaves you because you're like, how did I not know that this existed? And this is my intersection. It's social entrepreneurship with entrepreneurship. Beautiful. So when you were sitting in that conference, what happened for you and what shifts happened for you that changed the trajectory of your career?
So number one was a 5-day conference, and it literally was that almost like the cartoon, two people on different shoulders. And one of them is saying, oh, I could do so much with this. I could do this. I could do that. What could this look like? And the other shoulder was saying, no, you already have a stable job. You are steady in your career. Your job won't let you do this. And it was really like the yin and yang of these two shoulders. And finally, about 2.5 or 3, I finally said, you know what? This is my life and career journey, and I get to decide what I do with this. And that helped, just kind of talking myself out of these tension that was happening.
Right.
And so I came back to San Diego, where I'm still based, and I looked up teaching kitchens in San Diego. And within 2 weeks, I found this nonprofit that I'm still really heavily involved in. This was 8 years ago, called Olivewood Gardens and Learning Center. And it was a place where, through apprentice, really, I learned how to be comfortable. I was comfortable one-on-one with patients, but speaking in front of a group, speaking about nutrition, speaking with sharp knives in my hands, so chopping while talking, that was a new pace for me. And the other one, I think almost a bigger piece, would to feel comfortable, not feeling as sterile. And what I mean by that is that white coat and the silver and muted colors and lack of color, that's kind of the medical surroundings. And all of a sudden I'm in this 8-acre space. We're laughing, we're joking, we're using food as the conversational piece to really empower people to better health. And to me, that was such a wake up moment that I could let more of my color come through. And behind me, I have a peacock with rainbow color feathers. That's the vision that started coming, that I could bloom into something where I could bring my full self into my work, and that I had a lot to bring the world.
Wow. I love that. Wow. That's so cool. I mean, I wonder how many people are practicing medicine, but feeling like they can't express all their colors or aspects of themselves. Because sometimes you're so far in, you're so far in on your career, your investment in your education, your time, your energy you put in. I'm surrounded by people in Western medicine, and I'm surrounded also by students who are pursuing those degrees. And even one of my own children has expressed an interest in medicine. And I'm like, this is a very long road. It is a very long commitment. And so kudos to you to when you did discover this like inflection point of, gosh, I could be more that fits me. And you chose to take the step to do that. Like, that's a very, very courageous step to take. It's not common at all.
No.
I'm surrounded by MDs. I can't see any of them doing it. And also, I always look like the crazy one because I am the one who's like, I can be anything and I can do anything. I can write books and be a speaker, and I can evolve every few years. And sometimes I even think to myself, like, okay, yes, everyone tells you to niche down into your topic, but can't we evolve in our topic as we age with grace? Like there's an evolution that can also happen. And no one's here to tell me what box I have to live in. I'm always going to break the box anyway, because I have that rebellious spirit. So it sounds like for you, you were like, I am all these colors. And you had to like throw off the white coat and throw off the limitations to be your full self.
Oh, you have me so pegged. And that first year when I finally took that leap of faith, which was now 3 years ago, I truly felt vulnerable. Who am I without my name on a coat? Who am I without the white coat on regularly, without my name on a door, without a medical group behind me, with all the accolades that came with it? And it felt so vulnerable. Even my mother's like, well, this is my daughter. She used to be a doctor. I'm like, I'm still a doctor. No one took away my degree. I'm evolving. And I love that you use that word. And to stop the shoulds of, oh, you should continue in that road, or you should be doing this, and to finally listen to from within and say, what do I want to do? And I absolutely love to hear that has been such a part of you for so long, of kind of reshaping yourself. And we can call it being a rebel, or really realize that we are evolving human beings.
Exactly. And we're allowed to evolve. We don't have to commit to, and that's actually one thing that's interesting is if you watch what I call younger generation, not that I'm so old, I'm in my 40s, but I watch everyone in their 20s and they don't feel boxed into any 10, 20 or 30-year career nowadays. And I'm like, good for you. Like you're at least evolved enough to know at such a young age that you can keep reinventing yourself and taking interest in different things. There are new paradigms. There are new possibilities.
There really are.
And yes. So, Sabrina, when it comes to culinary medicine, will you define that for the audience today and our listener? Will you share with him or her, like, what is it that that culinary medicine is, and how are you applying it, and what excites you as you teach and apply it to the world?
Yes, it's interesting. I'm on the board of the American College of Culinary Medicine, and we literally in our board meeting last week were talking about the definition of culinary medicine. So there are definitions out there, and we are trying to make sure that people understand the definition no matter what sector of life one comes in. Meaning, if we are community members, what does that look like? Because sometimes the word culinary is not necessarily a word that everyone's familiar with. And then medicine can sometimes have that sterile connotation to it. So the way I like to describe culinary medicine is essentially, number one, evidence-based nutritional information meeting the culinary arts. So to describe that further, it's helping people understand the why. So what happens to my body if I have, for example, a sugary cereal with a sweetened coffee every morning, or a donut with a sweetened coffee? What happens to my body short term, and what happens to my body long term, compared to if I choose to have or invest the time and energy into making a breakfast that is more balanced, that has really nutrients as close to the way nature intended? And then what happens to my body short and long term with that? So once people understand the why, it doesn't stop there, because yes, we now have the knowledge, but if we don't have the empowerment to know what to do with that information, the buck kind of stops there. So the second part is the how. How do I now take these ingredients as close to nature as possible? How do I cook them? How do I cook them on my budget, my palate, my cultural upbringing? How do I make them delicious first and foremost, and really empowering my health to move in the needle or the trajectory that I'm hoping for?
It's so interesting. How do I cook them with my palate, with my culture, with my budget, with my time constraints? This is a question I ask myself all the time because I'm obsessed with food quality. And it's interesting because if you are part of the group that's trying to guide us, don't you feel like and most of the world is so confused on what to eat right now? There's so many philosophies, and even I get influenced sometimes because everyone right now is like high protein. And I'm like, okay, but now you've made my whole job trying to get protein into my body. Like, this is a new job. I don't even want this job. So how do you look at like what a balanced diet is? And do you even believe there is one? Because we're also bio-individual.
Well, so first I want to say that there's certain words that we use in this world that have this idea of you're either kind of on the diet or off the diet, or you're eating healthy or you're not. And there's this kind of good, bad scenario. You're cheating or you're not. So I really try to move towards that space of 80% of the time, really trying to eat in a way that is, again, where you can see non-processed or minimally processed foods, knowing what that is and having grace to realize that other 20% is, if I go to Paris, I'm going to enjoy the croissants and not feel like I'm cheating or off the diet. So when I say balance, number one, if you and I were having this conversation, or if I'm in a group with people with a certain chronic condition, number one, I'm asking them, what are people already eating? I need to know where I'm starting with this person or with this group of people, right, before I come in with my assumptions or my stamp on what nutritious or healthy is, or what is the step to move forward with.
Sure.
And once I know that, and there's two things with that. Number one, I'm learning their palate, right? So if I hear from you that you have a sweet tooth, for example, or that you like salty snacks, that's guiding me already on what recipes or what ideas I'll pull out of my hat.
Sure.
The other one is, I'm asking, if I ask you, okay, what are recipes that made you feel loved as a kid, or that make you feel loved now, that you prepare or that somebody else prepares, or that you love ordering at a restaurant, or a trip that you took? I am not only learning about you, I'm also making a connection and building trust to take the conversation, because in my head, my culinary side is getting ideas.
Right.
And then the side of me of knowing your diagnosis or what's the movement that we're trying to do is also bringing those together. So it's essentially information gathering, very different than, again, that sterile asking that happens in a typical medical appointment.
Well, isn't it interesting? Because if you were coming from the primary care angle, the questions would be more triage. Like, what is going on? Because I have to make sure I fix you. I'm only going to get to see you once or twice a year. And I got to make sure our bases are covered so you're protected. That's how I see a lot of doctors work with patients. Versus if you took that hat off, the questions are, what kind of diagnoses are you dealing with? What is the menu shift and the lifestyle shift we can make that's going to help reduce that? So in this world where we're seeing so much diabetes, pre-diabetes, inflammatory diseases, heart disease, etc., are you seeing this? Are you seeing these trends of people coming in so much so with those diseases and issues, and so that's more where you're trying to direct how they eat?
So first, I have to say with this, since I left direct patient care, I'm more going into spaces that I know people have certain chronic conditions.
Okay.
And so there's this pre-selection that takes place, right? So if people sign up to take this, like at Olivewood, we do an 8-week course, and I come in close to the end where they're so wrapped up in all this information and are now confused of, I can't touch anything because now I've been reading too much, of helping them kind of step back and look at the broader picture. But they're motivated, right? They signed up for this class, and hopefully some seeds have been planted that they're realizing even during these 6 to 8 weeks, they're starting to notice some changes from changes they made to self, in their household too, because in this space, it's often the people that do most of the shopping and most of the cooking. So you might have spouses that don't like these changes or children that don't like these changes taking place. But that's part of the gathering every week, is to have those conversations in community. So it's 12 to 16 people having these conversations about tension points that may be occurring in the household and how to get past them. Which goes back to what you said at the beginning. It's not just about the food. It's about lifestyle too. And what is that lifestyle? It is who you're surrounded by. Are you choosing to move your body throughout the day? Are you doing things to connect with self or to connect with others? Are you watching tipping points, as I like to call them? So are we doom scrolling on social media where that hour we're going to chop vegetables is now gone, and now we're ordering takeout yet again? So those tipping points, and often we think of them like cigarettes or alcohol or drugs, but sometimes it's having the TV on for hours, or social media, like I said, right, or having relationships that you go to lunch with somebody and you feel so drained, and to stop and pause and say, do I want to spend time with that person? Do I need to? Is there a way to shift there?
Yeah, and that's a powerful point too. I had a friend in recent years where I realized when we're out, I'm eating more and drinking more with this person. And so I finally said to my friends, like, this is not healthy. And they were like, oh yeah, you're right. So that's usually one of my cues. If my shift happens in how I'm drinking or eating with a group, I'm like, you are stress eating, literally in this conversation. This is not healthy. You brought up two things that I want to talk about. One, you mentioned spouses, and I started laughing because I'm such a health nut that in my home, I will only buy what I consider good. And my poor family is like, my husband has said it many times. He's like, you don't buy any food for this house. There's no food here. And I'm like, there's 2 pantries and 3 fridges of food. Like the amount of food we keep, most people would think I'm crazy. So I don't know what you're talking about. He goes, no, but there's nothing for me to eat. And what he means is his childhood foods. And so every once in a while he's gone to the store and come back with it. And I just look at him like, that's all garbage. Like, put it where you want, but I'm not touching it, and I'm not feeding the kids that stuff. Like, why would you buy oranges in a glass bottle? Like, who does that? But it's just funny because we grow up so differently. And I have a lot of childhood foods I used to love. I've just given them all up because I don't consider that part of my food rules of how I live now. And so how do you help people navigate their friction? For me, I'm like, I cook the food, you eat what's served. Like that's how it works. And I'm improving the taste of foods because I have teens now. So if I don't cook what they like, they will just go into the freezers and pull what they want. But how do you guide people to manage that normally?
So number one, I really think of it's not all or nothing, right? So like you mentioned your husband with the orange juice, of saying, okay, so you're cooking and everyone's eating what you're making, and he can reach for the orange juice and to give yourself, Grace, is the one that cooks and shops for the things that you would prefer people eat. And then, but if you think of the bulk, again, that 80% of the time eating in a way that really nurtures the body, there's so much less tension in the household. I have two teenagers also, and I can absolutely hear you on there's no food in the house. I'm thinking, wow, I've created 10 meals from what's in this house in the last week. But so that's a big part of it, is for people who have certain dishes. Like, for example, here in San Diego and growing up in Mexico, like tamales around the holidays are big, and holiday meals. Those kind of meals I will not touch. I will not tell someone, okay, we need to make this healthier. If this is your holiday thing, your tradition, there's certain recipes that are not to be touched.
Yeah.
But when I'm thinking day to day, are there ways to, if I'm just going to keep going down the Mexican road. Yeah. If someone has tacos and they always have beef tacos, for example, is there a way to have them dice vegetables and put them with those tacos? So it still has the meat. We're not taking away the meat, but now a steak that might have fed one person, so you buy 4 steaks. Now you're buying one for a family of 4. You're chopping that up, adding a lot of different in-season vegetables. You still have your paprika, your cumin, your chili powder. So and the salsas that go with it, all of that comes from the plant kingdom. So you're not taking away the tacos or vilifying them. You're just making them more nutrient dense and more plant forward, essentially adding more from the plant kingdom. And those tacos, like top 3 items that can sometimes help bridge people, are things like tacos, Indian food, Thai food, and stir fries. So those are ones that are so easy to add, or naturally a lot of people eat out, and there's foods that have, again, those that I mentioned that have a lot of plants in them. Those are really good ones to start moving people into eating more plants.
I love that. I grew up vegetarian, and so Thai food and Indian food is what we eat 90% of the time. So the whole week is Indian until the weekend. Then we go for Mexican and Thai food. And stir fry, of course, is easy. And I think about that a lot because in this day of reading and seeing so much on social media around food, you made a concept about, you said, I teach everyone to take a broader view, especially after 8 weeks of studying food, because if you're spending your time on social media right now, pretty much every food has been vilified. Every food, like today I was online and it said tuna has too much mercury. And I was like, but my son likes tuna sushi. Like what? Okay. But if you make every food the enemy, what are we left to eat? And it cuts nutrient variety and nutrient density out in a big way, and it'll ruin seasonality. So really, how do you help people navigate that? Because that's really, really tough, even for myself. I would say in all of health, as much as I focus on health, my 2 biggest area of struggles are hydration. Suck at hydrating. I'll drink green tea and caffeinate all day, but I won't hydrate. And then my second big one is, even though I believe in nutrient density and nutrient variety, so many foods have so many problems now. If I can't source it organic from a farmer I know or local, I might just avoid the food because it's too worrisome to me, the negative effects of it.
So it's funny, the example I was getting was going to be about organic specifically.
Yeah.
Often the answer to that, or the way I talk it through, is, so if you aren't sourcing that specific food, then what are you eating instead? And what I mean by that is, for some people, like in this 8-week program, perhaps they were getting takeout Mexican all the time, or others. And now they're thinking about getting organic, and they either can't find it or the price point's not where it's comfortable. And so instead they're getting the takeout Mexican food. So that's where it's saying, okay, so what are you eating instead of that? So that's the step back of saying, okay, if you're choosing, again, if we're in season here, and right now I'm looking over at my table and I have a big bowl with seasonal fruit. And that, again, we're talking about price points. So even if it's not organic, but it's locally sourced and in season, the flavor is going to be a lot more delicious. Right. So you're not having to add other ingredients that go with it. So bringing it back to sometimes going to a farmer's market, or encouraging someone to go to a farmer's market to see what's in season, because we forget. You can go to any grocery store, large grocery stores, and it could be any time of year. You wouldn't even know.
True. Very true. And I do think about that. It is so easy. Like and also when you have kids, they are on their own fixed menus. So I will fight for variety and no one will eat it and it'll all rot. And then eventually you give up because you're like, well, fine. If no one's eating it, who cares? We eat apples, we eat oranges. He eats bananas. That's the whole entire fruit menu of the home. And so it gets difficult to bring in the variety. But I have noticed for myself that if you're not actively fighting for variety, you're going to see it in your blood work. And that's the price. I can see it in my blood work. I just did a huge round and I'm looking at the blood work like, you have to change something. Something has to change. And so that's where I think it's so good to hire someone like you or work with someone like you who can kind of open your mind up. I oftentimes, if I have to make a big shift, I will hire a health coach because I know that my mind is fixed on a lot of topics. So for me to shift it, I need a colleague or practitioner who can open it in a different direction. So when people come to you and are like, look, I only eat this, I only want to follow this plan, but these are all the deficiencies I'm running, how do you work with them?
Yes. So it's interesting because people will often say, oh, if you work with kids, that could be really hard. And then I think there's so many adults that eat like toddlers, like they'll like maybe one or two vegetables and that's it. And so to me, it's not an age. It doesn't matter how many candles you had on your last cake or pretended you had on your last cake. It's really opening up that palate. But again, sometimes it could be the way it was prepared when you were a child, right? Sure. Or you only know how to prepare a certain vegetable. And that's why you stay in your comfort zone because you don't want food waste, right? I don't want a food waste, or I'm cooking for teenagers. And if I don't cook this, they're not going to eat it. So that's where, again, when I develop recipes and work with people and give them recipes, that's often what I try to do. And it's a balance between not having this recipe that's so long, but trying to create a recipe that is essentially you're teaching a tool on how to make an item. But that item, then you open it up and say, okay, this could be any seasonal vegetables, and then give ideas because someone might not know what a seasonal vegetable might be.
Sure.
So a stir fry, for example, or even a salad dressing, what oil. So the key point there is you're teaching the technique, right? You are talking about what oil am I choosing to put in this dressing and why? Right. What is it doing to your body? Like, this is short and long term, just like I talked about at the beginning, if I choose one oil versus another. Yeah. And then teach them how to make a simple dressing and then ideas on how they can make it uniquely theirs. Nice. So that's one example. But the same thing with tacos, stir fries. I mean, the list goes on, but that's the goal, is that it's technique-driven recipes to give people the tools, and then they can plug and play depending on what is in season.
So you're saying that you can first, at a foundational level, at least shift quality of ingredients, maybe away from inflammatory oils towards better oils. Then you're training on the habits of these foundational pieces, like making dressings, making stir fries. And then the next layer on top is show you that those are multidimensional. Like you can take the stir fry and go this way, or that way. Now that you've learned how to make a stir fry, it's kind of easy. You can just go in these different directions based on your season. I love that. I think that makes it so much easier. Like, to me, oils, obviously, these things I've obsessed with for a long time because I'm into whatever's foundationally important in the kitchen will affect all things for always. So it's like those have to constantly be good. But I agree with you. The idea of making the time for cooking is a lot. Like, nowadays, I'm taking an hour in the middle of my business day on the days I'm at home, and I'm cooking for 2 days at a time. But it's taking a lot of planning. And if the ingredients aren't there, like today, there were no cumin seeds. And I was like, no cumin? How do you even make Indian food without cumin? Oh my God. And then I was like, I have to go to the Indian store. Oh my gosh. Okay. All right. So I made the Indian food, irritated, didn't come out as good. And I was like, okay, so now I have to like pantry review, stock up properly, make sure everything is in order, and food prep, meal prep, so I can cook in the hour of my business day, because I never want to cook in the evenings. By the time you hit evening, I'm hungry. And so like yesterday, I got home at 8:00 from soccer tryouts, and I just ordered Sicilian oven soup and salad because I was like, who's got time? So like you said, there's so many moving pieces. And in this day and age where you have typically both people working full time, how do you support families in making the time to cook in the first place? It's not easy.
No, not at all. And the other part too that's happened. So if we go back a few decades, the kitchen was really the nucleus of people's homes, right? And a lot of that is bringing that conversation back, that it's not this laborious one person, and I'm not assuming it's the wife or the husband, or it's a two wife household that one of them's taking on that role.
Sure.
The sense of that somebody's doing that and everybody else is quote unquote doing life elsewhere, right? On screens, relaxing TV. It's trying to really bring it back. So if somebody has young kids, everyone can help in the kitchen, right? So if people are ending their day of having young ones tear lettuce or shake that dressing in a mason jar, or do homework on the kitchen counter, or have people, teenagers, spouses, young ones, taste what you're doing. Say, what do you think? Is it missing the cumin? Did you notice today it's missing the cumin? These pieces of empowering, again, of talking through. And for example, with my teenagers, they make smoothies pretty much every morning. And they have that foundation of, okay, these are the components of how to get a whole grain in there, how to get fruits, how to get vegetables, and how to get protein in that smoothie itself. And you'll be happy to know, I always want to make sure that people include some spice. So it's a cinnamon, or is it turmeric? Because that is a golden opportunity with every single meal to add some herbs and spices that bring in so many health properties. And a lot of people are not comfortable with herbs and spices. Same thing, it's an investment, right? To buy an entire jar of some spice that you might only use for one recipe.
Right.
So again, with that foundation of saying, okay, these are several recipes that you can use with this spice or this spice mix that I've taught you to make that doesn't have salt. You can choose if you want to add salt later. Right. But again, now if you make a spice mix, that is full of health properties, and you're empowering them to have flavor, right? Because a lot of times people cook healthy, and I'm doing air quotes here, and now it doesn't taste like anything. So why would they put all that effort into food that tasted like cardboard, right?
True.
It's bland. It doesn't have love, but it's like, oh, this is what I'm supposed to eat. No, it's supposed to be so good.
It's true. It's true. Sometimes I cook so healthy and then afterwards I'm hungry because I'm like, that tasted like nothing and it wasn't satisfying. Because again, I'm so focused on health. I'll be like 2 veggie burgers, salad, boiled egg. And it's like, okay, in the effort to hit your macronutrient goals, sometimes you're eating very disjointedly if you don't look up recipes and try to create something that's whole and holistic. And sometimes that happens to me. I'm like, okay, well, I ate my protein, I ate my fiber. Good job, done. Just move on. And then afterwards, I'm like, can I have some chips? Can I have something unctuous, like hummus, something that makes you happy? So how do you support people in being their healthiest according to, the nutrient requirements they have, but also helping them make it taste good? I know spices are great because I'm Indian. I cook with spices all day. That's how I cook everything. But how else do you support them? Because we're trying to control our fat. We're trying to control our carbs, some of us. So what's your support for them?
So again, starting with asking them, so what do they love? So if, again, a lot of things that can add soul and unctuousness, which I love that you use that word, are spices and are sauces or salsas that add more from the plant kingdom. So when I say, again, if I can teach people how to make a few sauces, like a green sauce from Africa or a salsa from Mexico, it can go a long way. So now maybe if we're teaching someone how to roast seafood, for example, like that's the lesson, so to speak, the fundamental. And with that, making 2 different sauces that we'll keep in the fridge for a week. And now you can use that sauce on that roasted fish of your choice. You can use it with eggs. Right. So if that's how you choose to get your protein, or you can put it on roasted chickpeas, tofu. I mean, there's so many different ways that now you can use that sauce. So taking a really basic technique and sizzling it up with these added pieces that also bring more from the plant kingdom. And that's often a key, is to make something that just makes the flavor pop, to not feel like, oh, here we go.
I love that you just said sizzle it up. It's like sizzle up your life with your super spices, because I teach super spices. I love that. The word sizzle. A lot of times I think of it as like spice up your life. How do you spice it up? Bring in the spices, And once you have that vibrant health, then you have the energy to go do everything you wish to do. My next question for you, before we jumped on, we talked about how you're teaching in different settings around culinary medicine, including teaching med students. And medical school students learning culinary medicine to me is like a life dream, to give them that exposure to food as medicine and all these kinds of ideas. So will you share what are some of these settings that you're teaching in and what you have seen in terms of these light bulbs going off and what you foresee going forward happening by this teaching reaching all these different groups?
Yes. So maybe I'll go by age group. So one of my favorites is actually teen culinary literacy. So teaching teenagers, just like when they get ready to move out of the house, whether it's for college, community college, or into a job, to know how to do laundry, how to do a budget, how to maybe write a check. I don't know how many people need to do that still, and how to cook for themselves, but not just ramen packets, right? So not something you put in the microwave and it's a sodium load on your body, but truly helping learn those tools. And that from middle school onward, it is amazing. This is where you can use peer pressure to your advantage, because doing mystery boxes and challenges, and they get really creative. TikTok has really actually moved things in a beautiful way with teenagers getting creative in the kitchen again.
Yeah.
So that piece is really empowering them to, and what is their why, right? Why would they put the effort in? And that question goes for all age groups. And for teenagers, the language has to be really careful, right? Because they are vulnerable for eating disorders, disordered eating. So focusing not on calories or kind of micronutrients and specific scales or otherwise, but really what is their goal? Do they want to do really well in school, and how food that's nutrient dense is going to help them concentrate longer? Is a goal a sport? Is a goal so they don't fight with their siblings at home, or are more patient with the people they live with or with teachers? Those can all be somebody's why. So that's a focus with the teenagers. Now, for med students and graduate students, I'm happy to report that there are over 60 medical schools, allopathic medical schools not in San Diego, but in the US, that have culinary medicine curriculum. Some is an elective, some it starts first year and goes through all 4 years. So it's moving in the right direction. And that's one of the pieces that I love about the work I do, is I work grassroots with nonprofit and then also nationwide to really work on big picture of the next generation of healthcare providers, that they have those pieces. And it doesn't mean they're going to specialize in it, but just to have the language, just like not all of us went into cardiology or other specialties, but to understand the merit of having that conversation of what is somebody eating, what potentially, and usually over 50% of the time, over 50% of people have at least one chronic disease.
Sure.
And of those, 80% of them are lifestyle related. So if we're able to talk about food and lifestyle choices, we might be able to either prevent, remove some medications, or sometimes even reverse diseases that are already there by having these conversations. Those are the tools that I want to empower medical students, graduate students that are going into healthcare fields to be able to have the language and the comfort to have those conversations.
I think that's really great, because right now what I'm seeing is, and sometimes I'm part of that crew, will say, you know what, doctors don't get it. Doctors don't make the time. Doctors just want to prescribe. Sometimes I see on the internet and I laugh, because they're like, doctors make so much money and doctors just want to prescribe you stuff. And I'm like, well, there's two sides to this coin. Doctors are trained in a certain way, and they look at the world sometimes through that lens of liability, and they're there to protect you. Like that's, and their heart, I think 99.9% of the time, is in the right place from what I see, because I'm surrounded by amazing doctors. Second of all, they're not paid well. Medicine has changed a lot. Don't believe that doctors are paid well now for what they do. They're getting crushed by the system. And then thirdly, they're not trying to not make time to give us dietary guidelines. I think what happens from what I see is they see the patient, they wish they had time to get into a 25-minute conversation of like, what are you eating and how are you exercising? But within the finite amount of time they have to use the tools they have to help you. But I do wish, as an integrative practitioner, that they would push harder or have like 5 handouts ready for everyone and say, look, you are probably not eating right. And it's probably that, like you just said, you have to train them to feel comfortable to open the conversation. It's not an easy conversation, right? If someone comes to me as a holistic practitioner, they are coming ready to hear what I have to say. Versus when you go to the doctor, you might not be as open and ready to hear someone say, I think you're eating too many carbs. I think that's the problem.
Mm-hmm.
And so it's about training them and then giving the patient that tool to say, hey, I need you to open your mind to a diet change or a lifestyle change or food changes. So how do you guide the med student to kind of understand how to practice differently within the system that they're going to have to live within?
I love that you're asking about med students because they're easy compared to physicians that are already in practice. Those are definitely the hardest, right? I think any of us, anyone who's been in a career for a long time, you know what you know, right? You are comfortable. And if somebody comes in and puts some tension or rubs up against that and say, hey, here's some more tools. Like you mentioned, there's this overwhelm. There's this, I know what I know. Not even I know what I know. I'm going to continue down this road. And it's hard. I mean, we spend so much time in allopathic medical school learning about medications, potential side effects of medications. But I still remember half day when I learned about the fat soluble vitamins, A, D, E, and K. Half a day of nutrition. And that's it. We're not learning about food and food-like substances and the effect that they have on our body long term. It's a new generation, like you mentioned earlier. Med students are so interested in this. And again, not all of them are going to go, but I've never done a class with medical students or residents, which I do with classes as well, where there's been this gawk, like, what am I doing as a future doctor or as a new doctor cooking? There's not that sense at all. It's like, wow, I am so happy that I'm learning this tool, experiencing it, because with the med students and residents, I always make sure that it's a hands-on class. So we're learning the didactics, we are cooking. So people are having the actual awkwardness of holding that knife, creating dishes, making decisions of what spice, how much spice. Again, with those, they have the recipes, they have the foundation, but the nuances of how much acidity or how much spice, that is on the chef of the day. And they'll hand me a spoon with it and want me to tell them if it's right. And I say, you're the chef today. Sometimes I'll taste it so I know what we're talking about, and then we'll have a conversation of ways to add. And then we sit for an hour having a conversation about the experience of cooking together, why these recipes were chosen, what nutritional properties come out of it, what are some chronic diseases where this could be related. So in the 3-hour session, it is a full wrap. So even if it's not a 6 to 8 week session, in a one time, at least there's been a seed planted of the giant role that discussions and experiencing food together can have on patient care.
I love that. I absolutely love that. As you were saying that, I was like, I need to find every residency program I know and connect her. Because then every student, like imagine if an entirely new generation just came out a couple of years from now and each one of them said, and by the way, your diet has a really big impact. I need you to exercise more. I need you to look at what you're eating. And I've even been to offices, like I went to dermatology once for an issue, and they had handouts ready. And I was like, thank you. I need the handouts. I am coming to you for an answer. And thanks for giving me something and circling what I need to do and making it that easy. Because sometimes when you're going to the doctor, you're asking for an answer. In my case, I'm really looking for a answer that I will chew on and decide if I'm going to listen to. But at least you're giving me more data with which to leave and research and come up with the answer that's right for me. So I love that you do that and that you teach this to the world. I'm so excited.
No, thank you. Thank you. It's been so different. And to give you an idea, how you mentioned when I was in primary care, the last few years we were in these pods. So our desk where we would dictate was right next to one of my colleagues. So he'd be dictating about the Framingham score of this patient and their chances of having a heart attack over the next 10 years. And I had my patients would actually send me pictures of, like, we set a goal that they're going to fill half their plate with rainbow, different color vegetables. And we talked about which ones and how to prepare them. So then I would have them send me a picture of their dinner plate. And so I would be dictating, patient made great strides with adding vegetables. We're going to add more. And, whatever the goal was. And it was just so funny. Like he and I would look at each other and I worked at a large medical group. So I would get the monthly charts of how our diabetic numbers, how our hypertensive, how many medications we were given. And we were right on par, right? So two totally different approaches to internal medicine and chronic disease. And I loved it because we respected each other and we would just look at each other and realize it was almost comical and yet a good reminder of how you can approach healthcare in so many different directions.
I love that. And as we collect more data on the impact of culinary medicine, we should be able to bring it in more strongly is the wrong word, but more consistently into the medical schools then. That'll be an interesting trajectory to watch. So Sabrina, I know we have to wrap up because I'm hitting the end of the hour. I feel like I could talk to you all day because this topic, the idea of food is medicine and finding the ways to incorporate it into our lives in better and better ways is such a passion of mine. But will you share any last thoughts that you want to share today that we have not gotten to cover?
Absolutely. So number one is really that piece of taking any empowerment piece possible. And again, my mission of the work is truly empowering people through nutritional knowledge and culinary literacy. So it's through classes I do. My podcast, Culinary Medicine Recipe, is all about that. And in there, we have both hosted episodes. And then I also have these bites, or in Spanish, bocadillos, that are 2 to 5 minutes long with exactly those little nuggets. So how to hydrate your body, what to put on your plate right now, because a lot of people have kids going off to college. What are great snacks to have in a dorm room that doesn't have any refrigeration? These little pieces, again, all of it, which is planting seeds and empowering people through food, delicious food.
Nice. I love that. And where can people find you?
Yes. So the podcast is available anywhere you listen to your podcast. So Culinary Medicine Recipe. It's also available on YouTube. And that one is through Alternative Food Network YouTube channel. And then my website is sensationssalud.com. Social media is all Sensations Salud as well.
Awesome. Well, thank you so much, Sabrina, for coming onto the podcast today. I find what you do so fascinating. Like you really have my brain dreaming into the future of what's possible for us if we continue to shift this conversation and keep thinking about food as medicine, culinary medicine, and bringing that nutrient density and love in. Like we're very much aligned on that work for the world. So thank you for joining me today. And everyone, make sure you follow Sabrina and check out her work. Thank you so much for listening. Share this episode with anyone who you think needs to listen to this. We are all about getting the message out that we can live healthier lives, and it all comes down to our plate and how we choose to live. So thank you so much for joining me today. Thanks for joining me for this episode. Check out our sponsor, Fusionary Formulas, the potent turmeric supplement used by doctors around the U.S. for patients with pain and inflammation. www.fusionaryformulas.com. I'm your host, Dr. Shivani Gupta. For more, visit shivanigupta.com. Subscribe to this podcast in Spotify or Apple Podcasts. Click the follow button or subscribe in any of the apps that you use. That's all I've got for you on the Fusionary Health podcast this week. You have the power to transform your health and achieve vibrant health starting today.